Hello everyone, welcome to Mind Academy. So today we are going to start our MPT exam preparation series with JAMIA MILIA ISLAMIA MPT exam paper 2022. So in this paper, we have 100 questions which we'll be solving in 10 days. Okay, so we'll be sharing one video for every 10 days in which we will have 10 questions each. So let's start. Our first question is the shape of normal curve is a bell shape, B flat, C circular, D spiked. So this question is from research methodology and statistics. Okay. So first we'll see about how a normal distribution is there. A normal distribution is a true symmetric distribution of the observed values where mode, median, and mean are the same and are together at the center of the curve. When the histogram is constructed on values that are normally distributed, the shape of columns form a symmetrical bell shape. So it is also known as normal curve or bell-shaped curve. So our answer will be bell-shaped. Okay. Next, the method of selecting a desirable portion from a population which describes the characteristics of a whole population is called as A, sampling, B, segregating, C, circular, and D, implanting. Here, the answer will be A, sampling. Okay, and why sampling? A sample is a subset of individuals from a larger population. Sampling means selecting the group that you will actually collect data from in your research. Okay. For example, if you're researching the opinions of students in a university, you could survey a sample of 100 students. And your university has thousands of students, but you can't go to each student. So you will take a sample of students who are studying in the university and you'll make a survey, and that will present the mood of other students. Okay. So in statistics, sampling allows you to test a hypothesis about the characteristics of a population. Fine. So next we'll go for question number 3. Which of the following is not a metabolic syndrome? First, microanemia. B, increased high density lipoprotein. C, hypertension. And D, obesity. So the answer will be B, increased high density lipoprotein. Now, how we got this answer? So first we'll know about metabolic syndrome. Metabolic syndrome is an accumulation of several disorders which together raise the risk of an individual developing atherosclerotic cardiovascular disease, insulin resistance and diabetes mellitus, and a vascular neurological complication such as cerebrovascular accident. Okay. So metabolic syndrome is a group of several disorders which may develop into atherosclerotic cardiovascular disease, insulin resistance, diabetes mellitus, vascular neurological complications such as CVA. Okay. So metabolic derangement becomes a syndrome if the patient has any 3 of the following. So when a metabolic derangement will become a syndrome, when out of this 5, any 3 will be present. So in this 5, what are those 5? Waist circumference more than 40 inches in men and 35 inches in women. Elevated triglycerides 150 milligram per deciliter of the blood or greater. Then reduced high density lipoprotein cholesterol HDL, which is less than 40 milligram per dl in men and less than 50 milligram per dl in women. Then elevated fasting glucose of 100 milligram per dl or greater, and blood pressure values of systolic 130 millimeter of Hg or higher, and or diastolic 85 mmHg or higher. Okay, so as you can see, out of those 5, one of those conditions is reduced high density lipoprotein cholesterol. Okay, so here as you can see, we have to find which one is not the metabolic syndrome, increased high density, because part of metabolic syndrome is reduced high density. Okay, so next we will go for question number 4, which is the common lung cancer in non-smokers. First, adenocarcinoma. B, large cell carcinoma, C, squamous cell carcinoma, and D, small cell carcinoma. So answer for this will be answer A, that is adrenocarcinoma. Now we'll see why it's adrenocarcinoma. About 50 to 60% of the lung cancers found in people who never smoked are adrenocarcinomas. That is cancer that begins in the cell that line the lungs' tiny air sacs and makes the substance such as mucus. About 10 to 20% of the squamous cell carcinomas is cancer that forms in the thin flat cells lining the inside of the lungs, and few, that is 6 to 8%, are small cell lung cancers, and the rest are other types of lung cancer. So we have this table. Okay. So as per this table, you can see there are 1, 2, 3, 4 types of lung cancers. So first is adrenocarcinoma, squamous cell carcinoma, small cell carcinoma, large cell carcinoma. So as you can see in the table, adenocarcinoma has incidence of 40 to 50%, location is peripheral, and its clinical association is clubbing and hypertrophic osteoarthropathy. Okay, next is squamous cell carcinoma, 20 to 25%, small cell carcinoma, 10 to 15%, and large cell carcinoma, 5 to 10%. So it is clear adenocarcinoma will be 40 to 50%. Okay. So we should also remember all the four, because question they might twist the question also, like which is the less common cancer in non-smokers. Okay, so that will be like large cell carcinoma, like that. Okay. Next, question number 5. Which route of drug administration carries the highest risk of adversely affecting vital function? First is A, intra-arterial injection, B, intravenous injection, C, circular, and D, intrathecal injection. So answer will be B, intravenous injection. Okay. So we'll see the route of drug administration, and we'll discuss about intravenous injection, how it has the highest risk. As you can see, it has advantages. It has its advantage: rapid effect, maximum control over the dose of the drug reaching the blood, and large quantities of drug can be injected. But disadvantage is this: injected drugs cannot be recalled by emesis or by binding to the activated charcoal. IV injection may introduce bacteria through contamination at the site of injection, and may also introduce hemolysis or other adverse reaction due to too rapid delivery of high concentration of drug to the plasma and tissue. Okay. Now we'll see a bit in detail. This is a good illustration by osmosis. So as you can see, IV administrations of nutrition and medications for those unable to use GI tract, subcutaneous, intramuscular, intravenous, intrathecal administration, then insulin, opioid, analgesic, and vaccines and antibiotics are provided through this dose. Okay. Pros is rapid medication delivery, calorie supplementation, fine, and cons will be adverse metabolic reaction and potential for infection. Okay. So answer for this will be B, intravenous injection. Next, we'll go for question number 6. Which of the following drugs is most likely to be absorbed from the stomach? First is morphine sulfate, B, diclofenac sodium, C, hyoscine hydrobromide, and D, quinine dihydrochloride. So the answer for this will be B, diclofenac sodium. Human stomach is capable of absorbing most acidic drugs and a very weakly basic drugs. Effect of pH on drug absorption, that is, acidic drugs better absorbed in acidic media, basic drugs better absorbed in basic media. Acidic drugs such as aspirin are better absorbed in stomach, that is in acidic media, while basic drugs, diazepam, are better absorbed in intestine, alkaline media. So what about diclofenac? Diclofenac is a weak acid and mainly formulated as salt, that is diclofenac sodium, which ionizes more at the alkaline pH, which resists the dissolution at low pH. Okay, so it remains unionized in the acidic medium, which is stomach. So diclofenac sodium is mostly absorbed in stomach. Okay, so answer for which of the following drugs is most likely to be absorbed from the stomach is diclofenac sodium. Next, we'll go to question number 7. That is, the hormone oxytocin is secreted by A. Testis, B. Ovary, C. Posterior pituitary gland, and D. Adrenals. So in this, we'll see different glands and the hormones they secrete. First is testis. They secrete testosterone. Ovary secrete estrogen and progesterone. Posterior pituitary secrete ADH and oxytocin, and adrenals, which is two parts, cortex and medulla. So cortex secretes glucocorticoid, mineralocorticoid, steroid, and medulla catecholamines, that is epinephrine mainly, and norepinephrine and dopamine. So answer for this will be posterior pituitary gland, because oxytocin is secreted by posterior pituitary gland. Okay. Next, we'll see question number 8. The immunoglobulin that crosses the placental barrier is A. IgG, B. IgA, C. IgM, D. None. So here we'll be discussing about all the immunoglobulins that are present, that is A, D, E, G, M, and we'll see which will be the answer. Okay. So IgA, it is found in mucus, saliva, tears, breast milk, protects against pathogen. IgD, it is part of the B cell receptor, activates basophils and mast cells. IgE, it protects against parasitic worms responsible for allergic reactions. IgG, secreted by plasma cells in the blood, able to cross the placenta into the fetus. IgM may be attached to the surface of the B cells or secreted into the blood, responsible for early stage of immunity. So, as per the question, the answer will be IgG, because it is secreted by plasma cells in the blood and is able to cross the placenta into the fetus. So, answer will be A, immunoglobulin G. Okay. Next, we'll move to question number 9. Which of the following is not an infectious disease? A. Dengue, B. Scurvy, C. Typhoid fever, and D. Whooping cough. So first we'll know what is infectious disease. Infectious disease is the disease caused by an infectious agent such as bacterium, virus, pathogen, or fungus that can be passed on to others. Okay, and what is infection? Infection occurs when an infectious agent enters the body and begins to reproduce, may or may not lead to disease. Okay, so now we'll discuss about the disease like dengue. Dengue is caused by the organism virus of Flaviviridae family, then V1, then V2, then V3, then V4. Typhoid fever is caused by bacteria Salmonella typhi, and whooping cough is caused by bacteria Bordetella. Okay, so as you can see, we have discussed how dengue, typhoid fever, and whooping cough are caused. They have some agents, okay, which cause the disease. But scurvy, that is answer B, it is a state of dietary deficiency of vitamin C and can cause bleeding of the gums and bleeding into all epithelial tissue. So as we discussed, only scurvy is the one which is not caused by any infective agent, okay, because it is just a deficiency of vitamin C. So answer for question 9 will be B, scurvy. Now we'll go to a last question of the day. That is, the primary characteristic of children with dyslexia includes first, divergent thinking, B, attention deficit, C, inability to read fluently, and D, engaging in repetitive locomotor action. So first we'll see what is dyslexia. Dyslexia is a specific learning disability that is neurological in origin. Okay, so it is has a neurological origin. It is characterized by difficulties with accurate and or fluent word recognition and by poor spelling and decoding abilities. Fine. The child with dyslexia or the patient with dyslexia, they will have difficulty in accurate or fluent word recognition and poor spelling and decoding abilities. Okay, these difficulties typically result from a deficit in the phonological component of language that is often unexpected in relation to other cognitive abilities and the provision of effective classroom instructions. Okay, so basic feature, though sometimes this also comes in short notes, so you can write this also. Basic features of dyslexia will be faulty word recognition, poor spelling, poor written expression, poor phonics, slow reading speed, poor phonological awareness in grammar, and word calling errors in oral reading. So, answer for question number 10, that is the primary characteristic of children with dyslexia, includes it will be inability to read fluently. That is answer C. Okay. So these were the first 10 questions. We'll come with more questions in the upcoming video. So if you like the video, if you find it useful, like and subscribe our channel and do share it among your friends. Thank you very much. See you all in next class or in the next video.